Grant Larson with Grant Larson Consulting. And today I'm with Tom Daniels from BioTissue. Welcome.
Good morning. How are you?
Excellent. Tom, tell us about BioTissue and some of the innovative products that you're working on.
Happy to. So BioTissue's been around for 15 years now. We started in 1997. Our founder is Dr. Sheffer Singh. He's an ophthalmologist, but also a cellular biologist, a PhD. While on faculty there at Baskin Palmer, he was very interested in amniotic tissue and the power of amniotic tissue to restore and regenerate normal cells, in this case on the ocular surface. So he worked on this clinically and understanding how to utilize it within various disease states, but more importantly, he determined a way to preserve the tissue, and he developed our proprietary cryopreservation process that fundamentally gives the product shelf life and allows us to get the tissue to the doctor and their patient so that they can use it at the time that they need to use the tissue. So over the course of those 15 years, we started by mostly just selling to friends and acquaintances of Dr. Singh's, but then over time we started to build the business and develop other innovative products along the way that are derived from amniotic tissue. We also now have a product called Prokera, and we can talk a little more about that a little bit later, but we also have another division called Amniox that takes the tissue. In this case, we are capturing that tissue or harvesting that tissue from the umbilical cord, and this tissue is used for diabetic foot ulcers, and it's actually preventing amputations associated with chronic non-healing foot and ankle wounds that are caused by the diabetic condition. So BioTissue is dedicated to the ophthalmology and optometric communities, and we are having a lot of success out there.
Now, Prokera is a product I want to bring to the audience today, and it really is a breakthrough in corneal healing. Tell us about this new product.
Absolutely. So amniotic tissue is, when it's used as a graft material, it can actually become a part of the ocular surface or a part of the wound if it happens to be a diabetic foot ulcer. So it actually becomes a part of the body as an allograft. What we also know about the tissue is that it can be a temporary bandage. And so what we did is we actually took the amniograft material, amniotic membrane material, and we basically wrapped it in a ring, and the ring is similar to a symblepharon ring, and when it's in this form, you can actually insert it under the upper lid and under the lower lid, and you actually have the amniotic tissue stretched over the corneal apex, and as a protectant, but also as an active biologic therapy to stimulate stem cell proliferation and a regenerative healing process. So what you end up having is a cornea that is healed faster and without a scar formation. And what makes it very useful to the eye care practitioner is that it can be easily inserted right in the exam lane.
Its indicated uses?
Its indicated for uses is many and varied. So it can be anything from a train wreck type case, a chemical burn, or a significant injury to the eye, a foreign body, something on this that presents in your office that you need to care for. Or it could be something more moderate, such as a keratitis or a chronic non-healing epithelial defect. So you can see that it can be from mild, moderate to severe corneal injury or keratitis to the eye. The mechanism of action for Prokera is anti-inflammatory, similar to a mild steroid, and it's also the only dual action therapy that most eye care practitioners have available to them, in that it's going to stimulate an active wound healing as well. So not only are we delaying or modulating the inflammatory response, we are stimulating an active biologic wound healing of the eye.
So how do you procure this tissue? How do you deliver it to practitioners and patients?
Great question. So we fundamentally are a tissue bank. We're regulated and overseen by the FDA. We're based in Miami, Florida, and we're vertically integrated. So we source the tissue, and we have living donors who agree to donate their placenta. After all, it will be medical waste unless it's donated. But at that time, we also are highly selective in the placentas that we actually procure. We're selective in a couple different ways. We only take scheduled C-sections. So if it's an emergency C-section, we can't take that. It has to be a scheduled C-section. And the mother is screened for, of course, all of the infectious diseases and from hepatitis to sexually transmitted diseases. And we also look for lifestyle too. So if there's anything that's high risk, then that placenta will not pass either. So the placentas are donated to us. We freeze them, and then we clear quarantine, and then we are able to process the tissue at our facility, our brand new state-of-the-art facility in Doral, Florida. And we make various products right there in our facility, and we put them into a bone freezer, basically ready for distribution at -80°C. At that point in time, we have a direct sales force in North America, and they are procuring the business, and we will ship directly to our customer in special environmentally controlled containers. And once they get to the location, we actually supply dorm-size freezers where they'll keep our device right there in the clinic. So we want to be as close as possible to the point of care so that when that patient presents, you can easily reach into that freezer and insert the Prokera when required.
Now, a very easy insertion process. Tell us about that.
Yes, absolutely. It's an easy exam room, exam chair insertion. We have these insertion guides that we supply, and we actually train our eye care professionals on how to insert it. It takes about 5 minutes, and I can walk through the steps here real quick for you. The first thing that we need to do is we need to rinse the Prokera in saline before use. So a copious amount of saline just to make sure that we get the glycerol material that was used in the cryopreservation process off of the product, because it can sting if it gets into the patient's eyes. So a simple saline rinse. We're now going to apply some topical anesthesia on the patient and use some type of a proparacaine or an alkane in the eye. You're holding the upper eyelid of the patient, and I like to describe it as you're creating a pocket that you're going to, in the superior fornix, that you're going to insert the leading edge of the Prokera into, and then you are going to insert that Prokera into that superior fornix pocket, and you're then going to, you can do it with forceps or with your fingers. Most people do it with gloved fingers. And then you're going to simply pull the lower eyelid down and drop the inferior aspect of the device into the lower fornix. Have the patient look straight ahead and check for centration, and it centers quite nicely, and you'll see the amniotic tissue stretched over the cornea and the edges at 3 and 9 of the device. But largely you won't see the device itself because it's up underneath the eyelids. And it's as simple as that. And we do require or recommend a tape sorphy, which is a small piece of tape or the Breathe Right strips that you might get at your local drugstore. And you take this tape and you simply put it in over the upper lid, and you're inducing a little bit of ptosis so that the patient isn't blinking over the top of the device. And that really helps out because if you're blinking actively over the device, it can be somewhat uncomfortable for the patient because it is a foreign body and they could feel it. And if you tape the whole eye shut, they won't be able to use their drops. So we do recommend that you just put a piece of tape on the upper lid so that they can continue to use their antibiotics if you want to continue to use a steroid, or potentially an antiviral, or even Restasis on dry eye indications.
Now, despite being an innovative product, there are some competitors in the marketplace. Tell us about the differences, though, between Prokera and other competitors.
Yeah, there's a big difference. In other words, all amniotic products are not the same. You might think that they are, but they really are not the same. And the key difference is how they are preserved. So as I had indicated, our process is called cryopreservation process. And fundamentally, we're taking the tissue and we are taking it to extreme low temperatures in that glycerol material that I was describing. So we're really suspending the active biologics in that tissue. Think of fresh frozen if you are thinking about that when you purchase meats at the store. It's similar to that. We're taking it to extremely low temperatures. It's not freezing it like hard freeze. It's not doing that. It's just the glycerol material prevents it from actually hard freezing. That's our proprietary process. The other amniotic tissue products, there are a few of them. There are not that many available, but they actually go the other direction in temperature range. They go to heat. So they actually heat the material, and what this will do is it destroys some of the active biologic components that are in the tissue. We maintain all of the extracellular matrix components, one being heavy chain hyaluronic acid, which is really a very important ingredient to stimulate the active wound healing. They virtually have none. They've lost all of the heavy chain hyaluronic acid in their preservation process, and through that process, we're the only FDA-cleared therapeutic device that can claim wound healing as an amniotic tissue. They can only claim wound coverage, so they're more of a passive therapy. Ours is an active biologic therapy. So big, big difference. Thanks for asking.
With all innovative products, tell us why practitioners should provide this to their patients in the office.
Yeah, I think the fundamental question that practitioners ask themselves is, I'm really not seeing problems today with wound healing. I don't have a problem. Status quo seems to be working quite well for me, whether it's a bandaged contact lens or maybe a drop is providing the therapeutic reaction that I'm looking for in my corneal wound healing. Well, I think the thing to think about is think back to that case where you had a non-response that might have led to a corneal scar or a visual acuity issue post-operatively because I got haze in my cornea. Or I have that chronic, recurrent erosion that keeps presenting every 3 or 4 months from one of my patients. So if you find that you have these chronic conditions that just aren't healing, whether it's a diabetic or some other systemic disease that's causing this, chronic dry eye condition, and you're just not getting the healing response, a biologic option is something to put into your toolbox. You've got pharmaceutical technologies, you've got mechanical technologies like bandaged contact lenses. A biologic option really belongs in your toolbox as well. And we believe it's going to add a nice new therapeutic option for you on those chronic, non-healing defects that present in your practice.
We talked earlier about one of the success stories. Mm-hmm. Just share that with our audience.
Yes, I happen to have it right here. I just received this on the weekend, and it starts off with Holy Batman. I have a patient that had an absolutely incredible Prokera result. This is from the doctor himself. He previously had a neurotrophic keratitis with no sensation to his superior cornea. His best corrected vision previously was 20/200. Contact lens, bandaged contact lens, healed him somewhat, but he always had the persistent epithelial defect and reduced sensation, neurotrophic. Here, just a couple of weeks after Prokera insertion, he has full sensation, and this eye is now his better seeing eye at 20/25. So we've been able to give his patient a pristine, optically pure, clear cornea, and this patient is extremely happy, and he's extremely happy as well. And we have lots of these. These occur all the time.
That's amazing. Tom, I want to thank you for your time.
Thanks a lot.
And for more information It can be found at www.prokerainfo.com. Thank you very much.